Hello, and welcome back to the channel. It's your public health safe space where meaningful conversation is what the goal is. And today we're continuing the autism conversation. And as I told you, this is a series, a 4-part series. So we're going on to part 2. And in this discussion, we're going to highlight certain things. We want to make sure we answer a couple of the questions that we had from our previous video. So it's another cold day, and we're not going to hesitate. We're going to go ahead and jump right into the conversation, into the discussion. And as always, I'm going to tell you, hit that like button, subscribe, share with a family or a friend, because most times our sharing the conversation is what opens the doors to advocacy. So let's share. Let's not be selfish. Let's advocate for ourselves, because we serve the community. We advocate for the community, and it turns around to benefit us all. So let's get on our journey. Today's a cold one, but we're here and we're going to talk about it. Let's go. Yes, so let's get the conversation started. And I'm going to share something with you that's private and emotional, but this is how we're going to transition into this part of the conversation. When my child was diagnosed with autism, they handed me a list of therapies: speech therapy, occupational therapy, ABA therapy. And then I saw the costs. Wow, thousands of dollars per month. If you're a parent and your budget is limited, at that point, in that moment, it feels like someone just closed a door in your face. But here's what I learned. There are doors. They're just hidden, not closed. And today, I'm showing you exactly where they are. Let's start with Medicaid. And even if you think you don't qualify, these are the first steps. With Medicaid, it covers autism evaluations in most states, often covering speech, OT, and behavioral health. Income rules for children can differ from parents. Some states allow disability-based eligibility. And I want you to always consider and remember that there is no disqualifying you. What it is, sometimes it takes more paperwork and it takes more time, but you are eligible. I want you to also check out the Children's Health Insurance Program, often called CHIP, if your income is slightly above the Medicaid limits. That's very important to know the resources and what we can and cannot achieve based on our income. As I said, the doors aren't closed. Remember, it is important also to reapply after diagnosis. A new diagnosis can change everything. We want you to get on the waiver list immediately. Ask about home and community-based services, HCBS waivers. This can cover therapies not normally covered, provide respite care, pay for in-home support. Yes, wait lists can be years long. We are aware of that. But here's the truth. The families who get help aren't lucky. They got on the list early, and so I'm encouraging you to get on these lists. If your child is under 3, then early intervention is important. Contact Early Intervention IDEA Part C. Free or sliding scale rates will apply to you. In-home services, often no formal diagnosis is required. It includes developmental therapy, speech, and OT. This is one of the most underused resources. And I want to mention for some parents, because someone was asking, school services are free, but we just need to know our rights. And this is why we're here and having this discussion. Under the IDEA, which is the Individuals with Disabilities Educational Act, your child is entitled to And I want you to listen what your child is entitled to. Free evaluations, an IEP. The IEP is the Individual Education Program. Speech and OT through school and behavioral supports. Put your requests in writing. Even if you make that phone call, even if you see someone and they say, just meet with me, also have your requests in writing. Documentation is important. Remember, you are not asking for favors. You are requesting what is your legal rights. Grants and nonprofits for most parents. Most parents aren't aware of the grants and nonprofits that exist. So we want you to look into Autism Speaks, as well as the ARC, local disability foundations, church or civic grants, as well as community foundations. I want you to also do certain searches. I want you to search for autism grant. And when you search for autism grant, you're going to search these autism grants with your state. So say, for example, you're in Ohio. Autism grants, Ohio. That's what the search should look like. Some offer small grants for therapy, communication devices, or safety equipment. Now, a lot of people aren't aware of university clinics and their sliding scale services. Many universities have speech clinics, psychology evaluation clinics, and OT programs. So we're here sharing the information because not a lot of people, when you have a child or family member who is autistic, it could almost seem overwhelming. And until someone opens your eyes or opens the door to communication, a lot of these services you are unaware of, or you weren't even thinking because you're getting through the day-to-day living activities. So this is why I'm sharing these things in details. This is why it's going to take 4-part series in order to get through everything. I don't want to condense it and then just to give you a bite size. I want to give you everything because not every option is for everyone. Now, services are provided by graduate students who are supervised by licensed professionals, often at a reduced cost. So you're going to search in order to get this benefit and see if it's near you in your area. You're going to search for University Speech Clinic near me. Again, in your search, University Speech Clinics near me. Now, if you are denied, don't stop. Do not get discouraged. Don't stop. Ask for the denial in writing. File an appeal. Contact your state's Disability Rights Center. I'm saying these things slowly so you could take notes. You could always pause the video. You could look at the transcript. You could get a summary of the video down below. But I'm still going to repeat it slowly. So let's start. Ask for the denial in writing. File an appeal. Contact your state's Disability Rights Center. Call 211 for local referrals. Denial is not the end. It's the beginning of documentation. See, we come across that word for a second time. Documentation is important. That's why we say we put things in writing. We ask for emails, things that we could hold on to, creating a file for a child or a family member. Now, I've got some questions and I'm going to go ahead and go through the questions and give the responses. So our first question is, what if I make too much for Medicaid but still can't afford therapy? Look into waivers, school services, sliding scale clinics, and nonprofit grants. We just discussed that, and I even went as far as to tell you how to search for these. The other question, I'm exhausted. I don't have the energy to fight this system. Well, advocacy and advocating, you're not alone. Ask for a social worker or case manager. This person becomes your advocate. You do not have to navigate this alone. Other question, what's the first step if I'm overwhelmed? Well, if you're overwhelmed, apply for Medicaid. Then ask about waivers. You're going to do this one step at a time. There is nobody who is dealing with this situation that goes through it, as we would say, easy breezy, without hitting a snag or having that exhausted feeling like nobody's here to help you. We are here, we're advocating, we're providing support, and we will make sure that we become a shoulder for each other to lean on. Now, low-income parents are not less loving, and I stress that. They are not less loving. They are just navigating a system that wasn't built with them in mind. Think about it. But information is power, and power changes outcome. So what we are trying to achieve today is the change of the outcome for the family, for the child, for the community. So power changes outcome. So if you're fighting for your child right now and feel invisible, I see you. I see you. You are not failing. You are navigating a complicated system while carrying more than most people understand. So I want you to save this video, share it with another parent, and look out for part 3. Because in that video, we're going to talk about the IEP. Going to that meeting can be very stressful, and that will be coming next. I am here to advocate for you. I am here to help you ease the burden, to remove that invisibility that many parents talk about. We are here as a community. We're here as public health advocates in support of our children, in support of our family members with disability, in support of autism. We will do all we can to ensure that everything goes as it should. The services are available, and we will ensure that you understand how to get to them. And until the next episode, I want you to take deep breaths. You are not walking alone. I am walking this journey with you. Thank you for joining, and we'll talk again soon. Enjoy the day.